about those stresses and strains that we're talking about today in terms of men's health?
Yeah, I mean, life comes at you fast sometimes, doesn't it? And everybody has got stresses and strains that they have to deal with. You just, I think, have to be able to reach out, talk to your loved ones, have some good friends around you. And that's very much what we're trying to do today, really, is with this men's health strategy, is to show that men's health and men's mental health is something that we need to meet people halfway with it. It's not about going to a special place to talk. It's about going to your football match and being able to talk. That's why the partnership with the Premier League, I think, is such an exciting part of that. But then the other work that we're doing within the mental health part of the strategy is very much as well about working with those community groups, things like Men's Shed, Andy's Men's Health, the other community groups that work around sports clubs, and we're designing it with those groups in mind, so that people are able to actually be in their community with their friends and also talking about mental health.
We've seen today's Labour leader publishing a letter that he's written to his son. Did your dad ever write anything like that to you?
No, I don't think so. But he was never backward in coming forward in terms of wanting to be there for me and to be able to chat about whatever it might be. So, yeah, it's a huge. I mean, fatherhood's a hugely important part of life for those who are fathers, and it's great to see Keir doing that, because I know how much his family means to him, and that sense of responsibility you get when you become a father is something that often really helps to strengthen people's mental health, but it can also be quite stressful. And we think that's an important part of this men's health strategy that we're bringing forward today.
Yes, I'm a dad too. I'm a handful of years behind you, but not too far behind in age. And it is stressful being a dad. You worry a lot about the children. I've got teenagers. But also, we're at that age that, I hate to say it, it's a horrible term, that people call sniper's alley. You know, there's the stresses of work, there's the stresses of worrying about your older parents, your own children, and then also the other things that can be a worry. Obviously, a lot of men lose their life by suicide before the age of 50. You've then got cancer being a problem, more men dying of prostate cancer than women die of breast cancer now, for example. It's one thing having this strategy, but what about tangible differences you can make? I mean, let's talk about prostate cancer. A lot of people want to see screening for that, for example. Can that be done?
Yeah, the National Screening Centre is actually looking at prostate cancer now, and I think they're going to report back very soon with recommendations. There have, of course, been some concerns about false positives and also about interventions that can have very negative unintended consequences. So we have to tread very carefully on screening, and we'll see what happens. It's rightly that is an independent clinical process that the government doesn't get involved in. But in our men's health strategy that we're putting out today, we are recommending the use of a device that can help men who've got a prostate cancer diagnosis to monitor the PSA levels in their bloods. And that is now going to have clinical validation, and we hope that by early 2027 we'll be able to, that'll be a big support for men who have a diagnosis.
But whether it's prostate cancer or anything else, clearly prevention is better than cure. I was seeing my friend Dermot Murnahan, formerly of Sky News, has stage 4 prostate cancer now. He's saying, get tested, go and get tested. But look, I'm 49 and a half. You have to be over 50 to get a test on the NHS. Surely these are areas where the government should be looking to invest more. Of course, lung cancer kills a lot of men as well, bowel cancer too. But these are areas you can focus money and potentially make a more tangible difference, can't you?
Absolutely, and we're very committed to that shift from treatment to prevention. It's right at the heart of our 10-year plan. But of course, you have to do it in a way that is clinically validated. So that the screening and the types of cancer and the types of screening that you do don't always give enough confidence that it's the right thing to do, because there can be unintended consequences. So, the government really does try and step back from that. But of course, if the recommendation is that we go ahead with screening on prostate cancer, then that is something the government would be looking at very closely indeed.
Let's talk about the mental health side of things, and in particular, things like the manosphere, the toxic masculinity. People will think about those individuals like Andrew Tate, who are who've been putting out, and to great effect, messages that give boys and young men a different view of what it means to be a young man. What's the counter to that? How do you tackle that kind of thing?
Well, I think there's the Online Safety Act, which is, I think, going to be a very important initiative in terms of getting the platforms to self-regulate far more effectively and to ensure that certain material just isn't there and isn't available to young people, but for the sake of this conversation, particularly boys under the age of 16 in particular. I think there's something around the role that schools can play, parents can play in terms of having those honest and open conversations with young men to say, do you really think that this is the right way to talk to a woman or about a woman? Those attitudes need to be taken on and challenged. We can't be brushing that stuff under the carpet. We've got to take it on.
You know that teenagers are tech savvy. They know how to get a VPN. They know how to get round this stuff and go and see that. There's a risk, isn't there, by making it more taboo, you also make it more attractive.
Yeah, I mean, on the VPN point, of course, you do need to be able to pay for the VPN. You've got to be able to get
They've got ways and means.
They may well have ways and means, but I do think that's an important sort of barrier to it. But yeah, look, kids are growing up very fast these days. A lot of them spend a lot of their lives in the virtual world rather than the real world. But you still have got, I think, real family commitment, community commitment. You know, you see it in the activities that I see in my constituency all the time. You know, once a year I run this funding fair where all sorts of different community groups come, and whether it's from the judo club to the music club to the local choirs, and you've got people of all generations coming together. You know, I've got the Air Cadets, the Sea Cadets in my constituency doing great work with young people, and I think there's real cause for optimism and hope, but there are some real challenges. I do think the sort of explosion in the use of social media is something that has hit society quite hard and quite fast, and we've got to be able to deal with that, tackle it and address it.
This may bring it a little bit closer to home, because I know your wife, Helle Thorning-Schmidt, former Danish Prime Minister, was she on the advisory board to Facebook as well?
Yeah, it was the oversight board.
The oversight board as well. So
Meta oversight board.
So look, I'm not going to get you to talk about what you talk about at home, but nevertheless, she's been involved in that kind of social media oversight. Surely that's an area where a lot more can be done, holding those businesses more to account for what they enable people to do.
Yes, absolutely. And it's how you get that balance right between, of course, free speech and allowing people to express themselves. You know, social media is here, it's with us. Nobody's ever now going to be able to close the whole thing down. So it's got to be about making sure that it works for society. That is about much better regulation, and it's about saying, you know, this is what free speech means, and this is what reckless and dangerous speech, incitement to violence, extreme misogyny, extreme racism, whatever it might be, that is not acceptable. And then we have to get those partnerships with the platforms so that they are actually taking responsibility for what's going on there.